Hello, I'm Stacy Pickering, Executive Director of Mississippi Veteran Affairs. Today, 22 military personnel and veterans will commit suicide. These are the latest statistics from the Veterans Affairs Administration. And unfortunately, Mississippi statistics really track right in line when you adjust per capita. September has been designated as Suicide Awareness and Prevention Month within the Department of Defense and the Department of Veteran Affairs. Military life and veteran life can oftentimes be complex, between deployments and relocations of your family to family and financial stressors. As an Air Force chaplain, I've personally counseled many active duty and National Guard veterans through difficult times. My personal experience has shown me the need to better educate and equip our local clergy with the tools to combat this suicide epidemic among our veterans and our service members.
Over the next 40 to 45 minutes, you'll have the opportunity to hear from representatives from the U.S. Navy, Air Force, and Army, as well as the Veterans Affairs Administration. Our whole goal is that you'll hear about the stressors that our men and women who wear our nation's uniform or have worn that uniform face and continue to deal with. We also want to make sure that you have the opportunity to get skills training of how you can help prevent suicide among our military community. Finally, Dr. David Walker, administrator of the GV Sonny Montgomery VA Medical Center in Jackson, Mississippi, will wrap up making sure you have the resources that are available to you and the men and women that you serve.
Now let's take a moment to listen to Lieutenant Commander Mark Torres, Command Chaplain, U.S. Navy Construction Battalion, Gulfport, Mississippi.
Hello, this is Chaplain Torres. I'm an active duty Navy chaplain, currently assigned to the Naval Construction Battalion Center, Gulfport, Mississippi. I've been an active duty Navy chaplain for 12 years. And in that time, I have served with shipboard sailors, also Marines, and most recently I've served with Seabees. So some of the concerns that I wanted to bring to the table involving suicide prevention or suicide-related behaviors primarily deal with those who are in active duty. As an active duty member myself, I also have undergone some of these stressors and some of these challenges, and I wanted to bring them to you today. Number one, concerning deployments. Active duty service members deploy quite a bit. All service members do, but active duty service members, since there's no reserve time, since there's no sort of civilian time or off time, that's the entirety of the life we live. And so deployments, when we're with the operational billet, is the primary mission, the primary focus often is to deploy. And when we deploy, it has usually 3 phases. There are multiple phases, but I'll highlight 3. When an active duty service member is deploying, coming up to that point of deployment, there's a sense of stress, a sense of dread of the impending separation, detachment. There's some challenges associated with that, having to mentally and emotionally detach yourself from relationships that you're undergoing in home port because you know you're going to be leaving soon. So there's that sense of dread, stress, and even when an active duty service member is trying to work through that, inevitably the family picks up on that stress and that dread, and so do spouses as well. And whether we like it or not, when we're in active duty, sometimes we have some sort of negative fallout from that moment of stress, that pre-deployment stress, and we might have arguments, and we might experience some separation anxiety, or we might just feel a little bit of sadness and gloom. And these are some of the realities that we face just before we're getting ready to deploy, because we're trying to get ourselves ready to separate. It also comes with the sense of pivoting our attention and focus toward the unit, because our mission is that deployment in that unit. And so we need to, in a strange way, sort of pivot our focus and energy toward the unit and getting everybody ready to deploy together, because the mission success depends on that and our lives depend on that. So we need to be very diligent in focusing on that unit and on that deployment. The second phase is when you're on deployment. Of course, deployments can go anywhere from a few months to up to a year. I had a friend of mine who had 5 children. He was an active duty Navy chaplain, and he was deployed for 13 months straight. And that was an incredibly difficult time. And so when an active duty service member is deployed, separated from their family, it comes with a variety of different types of stresses, and just sadness. You're out there, you're focusing on your job, you're doing your job, but at the same time you're worried and you're thinking about the family on the home front. And of course, thank God today we have cell phones, internet, and that sort of thing to reach back. But it's still very difficult to be separated from your family for that long period of time. And of course, as a service member, you want to reach back and help your family. You want to reach back and help your spouse and your children with their schoolwork, but you can't. So there's a sense of helplessness as well. Meanwhile, you are having to stay focused on your job, out in the field, out on the ship, and wherever you're at. So it's very difficult at times. But then the third phase is this, coming home or getting ready to come home. And that's another moment of transition. But when you come home from deployment, one of the things you experience, obviously you're happy and joyful to be home, but there's a new transition period, a new reacclimation to home life. And believe it or not, that can be very stressful as well. Ironically, you're home, but the transition and the changes themselves have inherent within them a sense of stress. And so you need to sort of reestablish your relationships, reimagine and re-identify your roles within the family. You need to pick up on certain functions and certain jobs and duties that you used to have before your deployment. And it gets a little complicated and stressful at times. Meanwhile, don't forget, you still have the unit, and you still have to keep some of your attention on the unit because you will deploy again. And you have, although you're home from your deployment, it's called the cycle or the deployment cycle. You have to start, you stand down, you kind of, downshift, but then you have to get ready for that next deployment that's coming up. So all of these transitions can pose some stress to the active duty service member and his or her family. The second thing I wanted to mention was this, PCSing. PCSing is an acronym for Permanent Change of Duty Station. So active duty, unlike reserve, we are in active duty 100% of the time. And so the Navy or the Marine Corps will move you from one duty station to the next. Now there's a lot of positives to that, but at times it is also a stress-inducing experience. I've known service members who have moved during the duration of their career, moved perhaps 15, 16, 17, even 20 times. They've moved themselves and their family members. And that is very difficult to do, especially when you have children who are in middle school or high school, and they are connected to their friends, and they're involved with sports or some sort of a club, and now it's time for them to move again. It becomes very, very difficult. And the move process itself can also be very difficult because although you've done it many, many times, there's really no PCS that's ever easy. They're all pretty difficult. And so a lot of times these active duty members, they're often thinking about the next move, the next duty station, the next set of orders. And so it's kind of difficult when they're in your community, in your city, in your churches. Sometimes they're reluctant to engage in the relationships, maybe not overtly, but somehow internally they're a little bit hesitant because they know that they're going to be leaving soon. And that's a painful reality. So sometimes with PCS coming up on the horizon, we know that as we're going to separate, it's time for us to sort of start pulling back from our relationships, pulling back from our duties and roles within the churches, within the community, because we need to get ready to move again. Also, concerning PCSing, there is the added challenge of moving into a new community. And for a service member, active duty in particular, that can be very difficult because, could you imagine you're living in one community for several years and finally you're starting, or for a few years, and finally you're starting to know where the stores are at, where the post office is at. You're starting to understand the flow of traffic, you're starting to get the lay of the land and become familiar and accustomed to things. Well, now it's time to move and you have to start all over again, trying to figure out where the post office is at, trying to figure out the flow of traffic at the Walmart parking lot. And all those things can be stress inducing, and it can add to a sense of disconnect, add to a sense of just kind of a burden, because at the same time you have to get your kids involved in new schools, and they had friends with their prior duty station, but now they are having to start all over again in their schools, and that's very difficult, and that actually does hurt a lot. That can hurt your active duty service members because they know that their families are also going through it with them. It's not just the soldier or the airman or the Marine or the sailor. It's the family members as well. So getting accustomed to a new environment can be difficult. So it's really important that as church members and church leaders, we remember that and we reach out to those active duty service members who are new to the community, because genuinely we are genuinely longing for community and fellowship outside of the military as well. But it's difficult. It's difficult because we're new. We know we're going to leave probably again in 2 to 3 years. But deep down, we really want that. And so despite these challenges of PCSing and deployments, active duty service members, we still want to be a part of a community. We still want to have meaningful relationships. We still want to have a lasting and meaningful contribution in our communities. So as church leaders, church members, it's vitally important that we remember some of these stresses that they undergo and consider those as we reach out to them and look for ways to involve our active duty service members, look for ways to build relationships with them, look for ways to partner with the chaplains on the base perhaps to see if there's any ways that we can build these bridges of fellowship, of shared ministry work, and really just try to come up and support and encourage these people who are out there on our ships, out in the fields, deployed overseas, who are out there doing our nation's bidding. Something to remember, and I hope that as church leaders we can all join together and support our active duty service members.
Hi, my name is Caleb Clark. I'm the chaplain of the 172nd Airlift Wing in Jackson, Mississippi at Thompson Field, the pride of the Deep South, the greatest air wing that has ever existed in the state of Mississippi. Most of you have probably at some time or other seen the large gray aircraft circling the Jackson metro area. I like to say those are my airplanes, but they're your airplanes as well. I am a second generation minister. My father has been a pastor in the Mississippi area for the last 40 plus years. And I'm a graduate of Southeastern Baptist Theological Seminary in Wake Forest, North Carolina. And up until this last summer, pastored for the last 12 years at Calvary Baptist Church in Yazoo City. One of my favorite things to say sometimes to someone when there's trouble is, I'll take it from here, or I'm glad to hand it off and have someone else say, we'll take it from here. A couple weeks ago, my wife and I were traveling back from Oxford from a visit with my family, and we passed a large accident. I hopped out, another motorist. We grab a guy and drag him out of the camper as it's just engulfed in flames. His burns all over his body, and when the paramedics arrived, they looked at us and said, thank you, gentlemen, we'll take it from here. And I was so relieved. That's kind of what I hope the clergy guidance here is today for you. As a military chaplain in the Air Guard, I'm typically a reservist. That means that I work full-time now, but most military chaplains in the Mississippi area are Army or Air Guard chaplains, and they get paid one weekend a month, 2 weeks a year. And we just do not have the absolute breadth and width to our ministry to effectively minister to all of our service members. Full-time, I minister and chaplain over 350 plus full-time people on base. And on drill weekend, that can swell sometimes to over 1,500 people. And I just do not have the capacity to see and to serve all those members. And for our clergymen, this is so vital to understand. We need you to take it from here. There are some things that happen in the life of a guardsman and a reservist in today's era that's never been happening before. When we hear kind of the elevator pitch, the recruiter's pitch of what the Guard is, sometimes you hear the phrase 1 weekend a month, 2 weeks a year. I've been in for over 9 years. Not one time in my chaplain career have I only ever worked 1 weekend a month and 2 weeks a year. There are constant phone calls from airmen and from soldiers who do not necessarily have a faith community. So 1 weekend a month, they're looking for the chaplain to kind of help bridge the gap. But I can't do that. Those of you who are pastors know that I can't do in 1 weekend what they need throughout the month. So it's very important that you become that very vital link in the chain of creating a sense of connectedness and community to your guardsmen who are in your churches and in your communities. As I was thinking about what I was supposed to say today, I began to reflect over just the last 6 or 7 months of my life as a chaplain, not just as a chaplain, but as an air guardsman. And I realized that over the course of the last 6 months, I have been in 4 different types of, we call them status. I have been telecommuting at some point. I have been on call at some points. I have been paid to be a military chaplain. I have been on federal orders, on state orders, and everywhere in between. And as I began to think about that, I was thinking about just the average young airman or the young husband or wife that are in my unit, how much chaos that brings. And with chaos often seeps in feelings of discouragement and despondency. We all love to have that next moment. What's the next thing? And as I've been looking at my own life, I too ask the question, what's the next thing? When are we going to get through with this stage? Well, that's where you step in, pastors. You are the next step. You are the next stage. I'm sure my information will be shared somewhere on this video, and I would welcome you to call me. If you are in the local metro area, South or North Mississippi, or wherever you are, I have people in my office constantly that aren't plugged into a church, and they don't know where to go. And as I expressed earlier in this video, for the first time in my adult life, I started looking for a church last summer, and I found one. But I'm going to tell you, church shopping is the worst. There's a feeling of disconnectedness. You don't know what you want or what you need. And if you are looking for opportunity to serve our military community, I encourage you to reach out to me, and I'll help catalog and push people your direction to help them stay and get connected in their communities. Just finding that place of connection and a state of knowingness that you belong somewhere, that you can be connected to your faith community in a real and a relevant way. And that need shows up in a military person's life all over the place. Just as a key example, I can think of one individual in my mind who I'm a friend with. In the last 6 months, they have been on 3 continents, flown worldwide, had their full-time civilian job put on hold, and their part-time military job take over and dominate almost every part of their life. And yet there's chaos. We don't know the finances are going to change. We don't know how the family's going to react. And they go from one week to the next not knowing if they're even going to be in the country or not. And it's just such a privilege to sit down with someone and open up the Word of God and say, this is how we can connect with you. If a service member or their spouse and dependents share something to a military chaplain, it's 100% confidential, even self-harm and harm to others. And when I say that to people, they immediately begin to go, well, hold on, what's happening? If they tell you they're going to harm themselves, don't you have to act? Well, not in a military capacity. And that sounds a little scary, and it certainly is a heavy burden for many military chaplains to carry, myself included. What it does is it gives that service member, that veteran, the outlet to say something without it counting against them. There are so many things that I have sat across the table from some service member and had them just pour their heart out. If they said it to anybody else, there would be the red alert buttons going off and all the sirens, and we'd rush them. But it was all they needed was someone safe to speak to. If you get to a point where they need to talk to someone and you feel like they're holding back because they just can't share it, your community has either an Army or Air Guard chaplain somewhere in it. We're everywhere in the state of Mississippi, and we can help you get in contact with the chaplain and let those service members express some of the brokenness and the heartache they're experiencing that oftentimes are experienced in seasons of war and conflict that they won't see anywhere else in this world. So I put that offering to you. It's a heavy burden to carry, but it's one that the men and women who raise their right hand to be military chaplains gladly shoulder for our service members. Pastors, again, I want to say thank you. As both a person part of the fraternity of the small church pastors and a son of one, I'm grateful for what you do. There is no amount of appreciation that can be stated that would get to where you are. So I say simply, thank you for what you do. And if we can be of any service on this side of the uniform, we at every avenue want to say we're here to help. If you need help, we can take it from here. Thank you.
Hey, my name is David Allen. I'm a chaplain at the Sonny Montgomery VA Medical Center in Jackson. I've been there over 12 years. I pastored for almost 30 years, and I was also in the National Guard for 26 plus years, and I deployed several times. And I just want to speak to you about some of the stressors that veterans experience and how those stressors continue even after they've left the military service. I can give you many examples and how it affects them mentally, emotionally, spiritually, and how they may need a special touch from someone like yourself that could come up alongside them and just encourage them and let them know that they're not alone, and that the Lord understands every fear, every doubt, everything that weighs on their hearts. Just a few weeks ago, last week, I visited with a vet, been out of the he was in Vietnam in the late 60s, involved in a lot of combat. And he can tell you to this moment the look on a young lady's face that he had killed that was an enemy combatant. And she had her infant with her at the time, and they were both killed. And it's been 50 plus years, and he still grieves, and he still bears guilt, and he still carries that. And he's only told a few people, and he shared that with me. And you may have men and some women in your congregations, in your sphere of influence that carry some burdens that still weigh heavy on their hearts after all these years, and they're dealing with some guilt, they're dealing with negative emotions, and so you may think, well, what can I do? And the bottom line is you can just listen. And you can put your arm around their shoulders, and you can give them a hug or pat on the back. You can let them know that they're not crazy, that they're not abnormal, that they're just dealing with things that most people never have to face, and it is a burden that needs to be shared. I know in my own life, from my deployments and the times that I dealt with death and with injuries, that some of those thoughts linger in my mind. And there's seldom a day that goes by that I don't see a picture of someone who'd been killed or severely injured that I dealt with in my times of deployment. And those things were real. And I'm not crazy, but it still bothers me. And I still need someone to talk to and to share with. And you're going to have folks that carry those burdens. And some of them, it may be such that it brings them to a point of just desperation where they're looking for a way out, and they may consider taking their own lives as an option. And you can have a part in helping them make it through that time. So I just want to encourage you, if you have vets in your congregation, or someone that you know that, especially if they've been through combat and dealt with injuries and death, that you try to befriend them. Now, I wouldn't recommend asking them to tell their glorious stories or anything like that, because a lot of them don't want to talk about it. But if you're close enough to them and they volunteer that information, then listen to them and encourage them and let them know that there is hope, and that they don't have to give up, and that they're loved. And if you ever need to talk to me or call me, I'm at the VA in Jackson, and anyone can get a hold of me there, or Mr. Pickering can find me. But anyhow, we're here to help. I'm here to help, and God bless you.
I'm Terry Parton. I am the Mississippi National Guard Joint Forces Chaplain. We're sharing with you today some of our thoughts and what we know about suicide and suicide intervention. Suicide is one of the greatest risks for our service members and veterans today. It's something we're very concerned about people in their lives. We want to share with you some things that will help you recognize someone who may be at risk or who may be considering suicide, and some things that you can do for them. I'm going to share with you today some risk factors. Now, another chaplain will share some things about warning signs. Risk factors are things that we all go through, but that we know affect people who are considering suicide. Now, just because you have these risk factors does not mean that you are suicidal or someone you know is suicidal, but we know that these things quite often accompany those who are considering it. So let me take just a moment of your time and share them with you. One is failed relationships. Many times what we find with service members and with veterans is that suicidal thoughts are brought on because of a deep relationship. Doesn't mean if you've failed in a relationship that you are suicidal, but if you know someone, pay attention to them, talk to them. Another is the history of suicide in their family. If someone has had a history of suicide, family members, make sure that you pay attention, that you listen, that you talk with them. If there have been prior suicidal attempts, we need to realize that raises the risk just a little bit. It's not a tremendous factor, but it is something that you need to be concerned about. Another is behavioral health. Now, we need to be careful. Not everyone that thinks about suicide or becomes suicidal has behavioral health or mental health issues. The truth is, many do not. They're simply at a point in their life that something has overwhelmed them and they're considering it. But if there are mental health issues, then we need to be concerned. Another is the use of drugs and alcohol. What we find quite often is that those things will lower inhibitions or may cause somebody to consider suicide even more than normal. Again, somebody that has a drug or alcohol problem may never be suicidal, but we know that that is one of the risk factors. Another couple is financial stress. Some people handle financial stress with ease. They don't have any problems. They can work through it. But especially on young people or maybe somebody on a fixed income like a veteran, it becomes overbearing sometimes. And so if you know someone that's going through that, or if you're going through it yourself, please be careful and reach out to others if you need to. Other is when somebody's going through some legal issues, if there are some legal concerns in their life. Sometimes veterans, maybe they've come back and they get into some legal trouble. They think it's going to be overwhelming. What we know is there's many agencies and others that will work with veterans. But our focus today is you being aware of risk factors. Our hope as chaplains, as soldiers that love and support other service members, we want you to stay alive. Thank you for your time. Thank you for watching this video. Please continue to listen and learn more about how you can help others, can help yourself if you go through these thoughts. Thank you for your time today.
Hello, everyone. I'm Chaplain Major Randy Wilson, the Group Chaplain for the 1108th Theater Aviation Support and Maintenance Group. And I'll be your host for this next section as we talk about suicide. For this discussion, you and I, for the next few minutes, will spend just a little while looking at the warning signs of suicide. As you see from the slide that's being displayed on your screen right now, you can see that there are a lot of pieces that make up warning signs of suicide. The reason for that is quite simple. You and I are very complex people. There's a lot of things that make up the disparate and separate pieces of our lives. But as you look at the slide and notice the words that's written on the pieces and the blocks, I want us to understand that just because someone displays one of these signs does not necessarily mean that they are at risk for suicide. It's meant to be merely a warning, not an indication. A warning should cause us pause, make us raise our eyebrow a little bit, and think seriously and long about the behavior that those around us are manifesting. As we look through this, I want us to understand that a warning sign is dramatically different from a risk factor. There are a lot of things that place people at risk for suicide, and the warnings are there to indicate that. But just because someone is displaying a warning sign does not mean they're necessarily at risk. So with that said, I'd like to take just a few moments and walk through what are basically 5 broad categories of the things that people manifest when they are at risk for suicide. The warning signs. that you and I should pause and reflect on. The first of these warning signs in this broad spectra of disparate things is noticeable changes in one's behavior, specifically sleeping, eating, hygiene, mood, whether it be depression or sadness, hopelessness, helplessness, anger, irritability, anxiety, up to and including when someone isolates themselves, or if there's a huge spike in their drug and alcohol consumption. Now, I want us to understand just because one of these things happen doesn't necessarily mean that someone is contemplating suicide. However, when there is a dramatic change in one's behavior, it should always garner the attention of those around them. It should be a warning sign that you and I pause and look at the person in their life and extend a helping hand if necessary. The second broad category has to do with very overt statements about death. And it could be very euphemistic and very ephemeral in the way they talk about it. It could be just something as posted on Facebook saying like, family would be better off without me. Or an Instagram post of how they just really can't go on. Or it may be something as overt and as dramatic as they really feel like they could die. These talking or hinting suicide, dying statements should be a dramatic warning sign to us that there are things going on in an individual's life where they're crying out for help. And that is a warning sign that you and I must be attentive to. The third large category, as you look at the puzzle pieces on the screen in front of you, has to do with finalizing one's personal affairs, such as giving away things that are very dear to them, their prized possessions. Out of the blue, they simply begin to discard things that they've always treasured and always cherished. Or suddenly, out of the blue, with no provocation or reason, they make a very detailed will and file it. These are things that should be a warning sign to you and I that something has went awry dramatically in someone's life. The fourth broad category of warning sign has to do with the feelings of sadness, helplessness, and hopelessness. Now, I realize that all of us can wake up a day being moody. I'm not talking about someone that's just having a bad day. We're talking about something that's chronic, something that lasts for days, weeks, and months, a funk that someone just cannot seem to extricate themselves from, or a complete and total abandonment of all emotion other than sadness and despair. If these persist for any length of time, it should be a warning sign to you and I that the person that we're observing is at risk and may need a hand. The final big category has to do with relationship problems, financial problems, and or legal problems. Now again, just because someone is having difficulty with their significant other doesn't mean that that's a warning sign. However, protracted and prolonged exposure to relational problems, financial problems, and legal problems may be a warning sign of behavior that has caused those things. And that is the thing that should garner our attention. Those particular things together form the puzzle pieces that frame the puzzle picture that we call warning sign to suicide. Before we pass on to the next presenter, I do want to mention just a couple important things. You and I must know the people that we work with, the people that we are around, the people that we love. We have to know them well enough to recognize when something has went awry in their life, when their behavior has changed, when their thought pattern has changed, or when their thinking has changed. If they remain strangers to us, we will never recognize when these subtle changes take place that could be a warning sign. It means we must be involved in the lives of people that are around us. To quote, as a chaplain, yes, I am my brother's keeper. And the final thing that I want to mention before we walk away from this particular slide and the next presenter comes is that despite the fact that you and I are complex people, our behavior can give dramatic indications as to what's going on in our lives. If we are attentive, if we are studious, and if we care, We can notify, see, and observe when any of those changes take place that demonstrates that we or they are at risk.
I'm Chaplain Sean McMacken. I'm the command chaplain with the 194th Expeditionary Sustainment Command out of Monticello. I want to again thank you for taking the time to invest in helping protect our soldiers from this great enemy, suicide. And so as we continue to talk about this, we've talked about risk factors and warning factors. We want to look at some proactive protective factors that you can utilize to help you in this. The first one I would mention is from the standpoint of the organization, from a command climate standpoint, we want to make sure that commanders and senior leaders, all of us are leaders, that we take the time to know our soldiers, to know our people. And as we do such, there will be times where you will recognize things, maybe something that seems insignificant or minor, because you know your soldier and you know that person and you've spent time with them. It will stand out to you as something that's just not quite right. And that's the point at which you want to make sure that you take the time to ask the question at that point. And for the soldier, the individual soldier, there's several things that you can do as protective factors. The main thing is to maintain positive and good social relationships. Relationships are key to our mental health and our mental stability. And so what we find is that there are many people who get into troubled waters, different things happen in their lives, and because they don't maintain good, close personal relationships, they don't have someone else to lean on, to come alongside them, to help, to carry their burden with them. Another protective factor that we want to talk about today is to recognize that some people just have the ability to cope better than others. Coping ability is something that is across a spectrum for different people. And so one of the things you can do is maintain good behavioral health and personal health by recognizing whether or not you have the ability to cope with things when they hit you, problems in life, minor problems, major problems. And then take the steps to train yourself to handle stress better. We want to make sure that all through this content of this video that we help you to recognize there's no stigma, there is no issue with you seeking and asking for help, especially professional mental health. And so those are some of the things that you can do to help yourself to cope, to learn better skills, to learn better life skills, and to train yourself to be more resilient. Another thing from the chaplain's perspective, obviously, we want to mention is a concept of a faith-based group of beliefs. Always what we find in situations where people get under problems or life overwhelms them, that the people that are most successful in handling problems typically have a faith basis for how their outlook in life is. It doesn't mean you have to be a Christian, just something that you hold on to as a bigger power, a higher power, something outside of yourself that you can look to and draw strength and energy from in a moment of crisis, in a time of need, when you feel like you're under it. And lastly, what I'll mention is to make sure that you participate in any kind of group activity that you can, similar to the coping skills that you learn from going to classes in behavioral health, seeking help. Anytime you do a situation where you are in a group setting, training in the Army and the military gives us all kinds of opportunities. But even in your civilian world as a traditional National Guard soldier, find ways to plug into either your community or to a small group. It could be something as simple as a video game group, but something where you have connectivity and relationship. And those are some of the things that we look for that help folks in the midst of crisis as protective factors. And so now we transition to the point where we're going to talk about, there are several ways to handle when you happen upon someone who is in a crisis situation, when you encounter someone who is in the throes, in the midst of a deep darkness and depression, and it's overwhelmed them. One of the main tools that we like to use, it's a very simple tool, and it's an acrostic, just a simple tool that we use, and we have it printed on cards that you are able to get as a resource. But it's the ACE method. The ACE method. And the VA actually puts out their card, and so does the National Guard. The ACE is the acronym that stands for Ask, Care, and Escort. And it's just a helpful way to remind you of how to walk a person through who is in the midst of crisis. So the first thing with ACE is to ask, to genuinely, actively listen to someone. And if you need to, never be afraid to ask the question, are you thinking about killing yourself? It is the most important question you can ask someone who you think is contemplating in the midst of a great depressive state, the last resort of suicide. So you might it might be something where just, again, as I said, the leaders know their people and the soldiers. You know a friend, hey, is everything okay? How's everything with the family? But at some point you want to come to that place where you ask the question, are you thinking about suicide? Are you thinking about killing yourself? And then once you cross that boundary, what we find is it's usually a relief to yourself and to the person. And then you want to move into the mode of caring for that person. And caring doesn't necessarily mean you are the main person responsible for providing care for them. It just means in the midst of this crisis that you're caring for that person, which means, number one, remove any and all means of danger that is around this person, anything that they might use or could use to harm themselves or harm yourself. And then we also want to listen to them, actively listen. When you're talking to them and they're unloading and telling their story, you want to listen to them, and actively listen means that you engage them. And then lastly, E is for escort. You want to make sure that you never leave a person in a crisis situation by themselves. If you have come alongside of them to help them, you maintain that connectivity with them. So then what you want to do is you never want to force someone to go anywhere with you. You make the suggestion to them, hey, let's go and see the chaplain, let's go talk to the chain of command, let's go to the hospital, let's go somewhere. If they don't want to go, then you just need to take that opportunity to seek help yourself. You want to call 911, a crisis intervention hotline, any of those resources that you know that are available, but never leave the person alone. You want to always escort them. And so we hope that this is clear. We thank you for taking the time to educate yourself, but also want to make sure that everyone out there knows that there is always someone willing and ready and able to help you. We're just a phone call away. Please do not hesitate. Ask for help. Thank you.
Hello. You've already heard from our other chaplains about risk factors, warning signs, protective factors, and you heard about our ACE model, about asking, caring, and escorting. I'm Chaplain David Morris, the 155 Armored Brigade Combat Team Chaplain, and the full-time support chaplain for the Mississippi Army National Guard. I'm here to talk to you about stigma and resources. There's a myth out there that anybody that's going through any kind of suicide ideations, that you're weak and that you're not able to manage yourself. Well, that is far from the truth. You've got resources, you've got ways and availability to make sure that you can get through the things that you're going through. I'll tell you, there's two audiences that I'm really speaking to. Talking to those that are in the military, or maybe your previous military, and those that are in the civilian sector. Regardless of where you are, there's help that can be given. If you're in the military, you've got some chaplains, you've got behavioral health specialists that can be able to get you through. Remember, you're not weak. You're going through something that's normal. Maybe you got some panic in your life, or some things they're going through that's giving you some anxiety or some depression. This is not abnormal. Find your chaplain, find a behavioral health therapist, find someone either through a talk line or Military One Source that can give you the help. Also, you got hospitals and other community care systems, maybe a professional doctor or psychologist that can be able to give you the help that you need. If you're in the civilian sector, or even in the military, you've got other resources too. Maybe you have a religious leader, or you have a pastor that you can talk to. If you're able to do that, I'm sure that they'd be more than happy to offer their resources. But I'll tell you, at the bottom of your screen, you're going to see my phone number and my email address. Again, I'm Chaplain David Morris. My number is 601-624-0963. Please do not hesitate to give me a call. I'll get you in touch with the right person to be able to get the help that you need. Remember that you are loved, you're cared for, you can be taken care of. Your life is worth it. Make sure you get that help, and God bless you.
Hello, I'm Dr. David Walker, the Medical Center Director of the GV Sonny Montgomery VA, and I'm also a veteran. I served in the United States Air Force from 1987 to 2003 as a psychiatrist. And as the director of the VA, I'm still a psychiatrist and still see patients. I treat opioid addiction. And I want to thank y'all, because you're sitting in the chair because you care, because you want to get to zero suicides. The VA has a national strategy to prevent veteran suicides, and you are a part of it. Yes, it's a national strategy, but you are a part of it. So when we think about change management, because we're trying to change behavior, The first thing is the awareness for the need to change. And with 20 to 22 veterans killing themselves every day by suicide, we know that there's an awareness. The next is the desire to do something different, to change. And you wouldn't be in the chair if you didn't have that desire. Now you've been getting knowledge and what to do, what questions to ask, what resources. Those are the things that are critical. Now you have the ability, and now it's about repetition. But in the national strategy, you're actually doing more. We know that the connectedness that one feels when they're in, whether it's a house of worship or they're with people for friendship and fellowship, that has meaning and it can be protective. So doing what you do as clergy is critical because it actually helps provide the veteran with a support system. And we know that support systems make a difference. And you've learned that when people start moving away from their support systems and doing other kinds of behaviors, that you're starting to see risk. So that's what you're doing. The other is that you've learned, and that is the asking. The asking questions, the knowing about referrals. And those are the things that are critical because we know that just asking doesn't make somebody go out and commit suicide. And then what do you do with it? We know that, as you've learned, that many veterans over the age of 50, and for me, that's now my definition of middle age. It keeps changing every year. But basically, we're all at risk, and some of us at more risk than others. But you're going to make a difference because you're part of the national strategy. Because both with being the clergy and what you can do for a sense of community, and then from an assessment and a referral standpoint, those things are critical. Because we cannot solve this national crisis of suicide alone. No one medical system can solve it. We all have to work together to solve it. Thank you for your commitment to do that. Thank you.